Hello friends, hope you all are doing great in your life. This is a simple awareness video. One of the most commonly used drugs, which is pantoprazole. This group, there are like so many other drugs like omeprazole, esomeprazole, rabeprazole, which are commonly used, which also fall in the same category of the drugs. So these drugs act by a mechanism which is called as proton pump inhibition, which is responsible for the secretion of the hydrochloric acid within the stomach. So when you inhibit this pump, proton pump, then what happens? The amount of hydrochloric acid which is secreted in the stomach is actually reduced. So these medicines are usually commonly available in the brand names like Pan 40, Pantoprazole and multiple other names. So where it is actually used. So before the advent of this drug, this drug was invented for the treatment of the gastric ulcer. Now we are taking pantoprazole for few days and the gastric ulcer is getting resolved, gastritis is getting resolved. But earlier what used to happen is like depending on the location of the ulcer within the stomach, like whether it is in the top portion, whether it is in the bottom portion or whether it is in the side portion, the ulcer would not get healed. So what they used to do is like they have to cut one part of the stomach. Depending, there are different types of surgeries depending on the location of this ulcer which is present in the stomach and which part has to be cut and removed and how it has to be joined. So these are called as Billroth options. But after the advent of the simple drug pantoprazole, this surgeries for gastric ulcers has become outdated. There is no surgery which is being done for gastric ulcer these days. So what are those conditions that are required in which decreasing the hydrochloric acid secretion will be useful? So that is the main treatment process which we are using pantoprazole for. Like for example in peptic ulcer, so what happens is there is a hydrochloric acid which is which is getting secreted in the stomach, which we all know. So if I put hydrochloric acid which is getting secreted in the stomach in this part of the skin, what will happen? The skin will get burnt or damaged. But the same thing is happening within the stomach every day, but there is no damage which is happening in the stomach. How this is happening? This is happening because there is a protective layer within the stomach which actually prevents any damage being caused by the acid which is secreted in the stomach. But what happens in certain conditions, like when you are stressful, when you are taking some drugs which causes damage to this protective layer, the acid directly comes in contact with the stomach wall. So what happens? So this part of the stomach wall will get damaged because of the acid, right? So this will lead to the peptic ulcer. So in such condition, if you reduce the gastric acid secretion, this ulcer will get automatically healed. For example, if I get some injury over here, what should I do? If I keep it in such a way that it doesn't get infected, the wound will get healed by itself, right? In the similar way, the same thing happens within the stomach as well. So the next condition is the GERD, gastroesophageal reflux disease. As I was telling, the protective layer is there only within the stomach, not in the intestines, neither in the food pipe, which is there from the mouth to the stomach. So in certain conditions, the acid along with the food contents come up, they reflux up to the food pipe. In such conditions, what happens? The esophagus, the food pipe gets damaged, the lower end of the food pipe gets damaged and you feel a sensation of heartburn. So this is called as the gastroesophageal reflux disease. So in such disease also, to reduce the damage, to reduce the sensation of heartburn, we usually give this pantoprazole drug. Apart from that, there is a condition called Zollinger-Ellison syndrome. This is not a common condition. In this condition, the gastric secretion, hydrochloric acid secretion itself is much higher when compared to any other usual persons like normal secretion like you and me. So, and the next condition is the Helicobacter pylori infection, which is usually present along with the gastric ulcer. Sometimes this gastric ulcer, if you, it might happen because of the acid and it might happen sometimes because of the infection as well. So during those treatment of the infection as well, usually go. But in most of the people's life, we would not have taken for these reasons. We would have mainly taken for prophylactic reasons. Like for example, whenever you see a patient who has many comorbidities like diabetes, hypertension and heart disease, they will be on so many drugs. In such patient prescription if you take, definitely there will be some drug for gas which your doctor would have been advising you to take on an empty stomach. That is usually this drug. So whenever there is so much amount of drugs now, so what happens is like these drugs invariably cause some kind of gastric ulcer. To prevent that, prophylactically we are giving this thing. And the most notorious drug which is known to cause this gastric ulcer is the painkiller medicine, which is called the non-steroidal anti-inflammatory drugs, which is usually the diclofenac. So these drugs can cause gastric ulcer, so we give it in a prophylactic way. And apart from that, antibiotics, whenever you are getting an antibiotics also, you usually get a pantoprazole along with that. Apart from that, during stressful conditions also, this protective layer in the stomach will get affected. So prophylactically we give pantoprazole. So, and whenever a patient is getting admitted, now if you see the entire list of drugs, the first drug it always starts with the pantoprazole, because like whenever a patient is getting admitted after a disease or suffering from a disease, it actually causes so much amount of stress, and over and above you are giving so many drugs, so which might lead to gastric ulcer. So this drug during a short course of time, it doesn't cause much damage, so it is always the risk is more, the risk is less than the benefit, so hence we give this drug always in all the ward patients. So apart from that, even during anesthesia and before the morning of the surgery, although the patient is fasted for more than 8 hours for solid food, we still give them a pantoprazole, because like during surgery we always secure a tube after anesthesia for to support the ventilation. In such cases, there are chances the gastric contents might regurgitate up and come via the food pipe and might enter into the lungs. So even if it enter into the lungs, the acidity might cause more damage. Hence, to decrease the acidity, we usually give pantoprazole as a prophylactic measure. So this pantoprazole is a over-the-counter drug. If you go and ask in any pharmacy, give some drug for gas or bloating issues, they will give you pantoprazole. It is very cheaper also. So, and when should we take this drug? It should be taken in the morning, because this usually acts for 24 hours and usually it is prescribed for once daily, except for certain conditions where we usually sometimes prefer twice daily dose. So hence you are taking once a day. If you are taking this after breakfast, the amount of hydrochloric acid that has to be secreted has already secreted because of the food. Now if you take this tablet, there is not much of a use. So hence, before in the morning, before breakfast, at least 30 minutes before that, you should take it, so that the maximum effect of the drug will be there. So whenever coming to the surface, I am actually making this video because during my internship I saw a female patient. She's a young female. She came with the complaints of tiredness. So when you examine her eyes, there was a significant pallor in her eyes. So after the blood investigations, we found that her hemoglobin was 8. So we wanted to find out the cause. So we were there was no blood in the stools. There were no parasites. So her menstrual history was also normal. There was not much of a bleeding. Then we were trying and finding out why the patient is actually having so much anemia. So then we found that the patient 2 years back, she has been prescribed pantoprazole for some reason, either because of gas issues or ulcer issues. So we are not sure about the issue, but she has been prescribed 2 years back. But since then, she's without visiting the doctor again and checking whether the drug should be taken or not. She has been continuously taking the same pantoprazole for the past 2 years. So what happens is, the major vitamins and minerals which are required for the hemoglobin formation are iron, and apart from that, vitamin B10 or the folic acid and the vitamin B12. So this iron is usually getting absorbed in the stomach, majorly because of this acid secretion. So when you block the acid secretion, the iron absorption in the stomach actually decreases, because of which she developed anemia. The hemoglobin levels dropped. So hence it should not be taken for a long term. But in certain conditions, for example, as I was telling, in the comorbidities, we usually prescribe for long term. So, as a pain and palliative physician, we always prescribe pain medicines for the cancer patients to decrease their pain. So, we usually give the patient for a not a long term. Whenever the patient is taking this pain medicine, he will be continuously taking this pantoprazole also, sometimes even twice daily also. But still, they don't develop these things, because of the stress. Because of these conditions, then acid secretion is usually much higher, so it doesn't bother them much. So sometimes there might be formation of the polyps within the stomach wall if you are taking it for more than 1 year, and sometimes it might cause interstitial nephritis, also damage to the kidney. So whenever I am saying this side effects, so you will be taking pantoprazole right now, so you need not get afraid, because usually these side effects are less than 1%, these side effects. But the major reason why I am making this video is, like, just because it is less than 1%, you cannot keep on taking it long without any indication. Medicines, all the medicines literally have some side effects. Okay, so we always weigh the risk and benefit. So whether the risk of getting this thing is much more compared to the benefit which the patient is going to get. So the benefit, when the benefit is more, we usually prescribe for long term. So even I have told you, I have taken this drug for at least 10 times in my lifetime, like even more maybe, because like whenever I get an infection, I get this drug. And apart from that, I got gastric ulcer twice, for which I have been given this drug. So apart from that, I have been admitted twice for during all these times now. So all these things usually happen. So hence the bottom line is, so if you are prescribed some drug for some duration of time, please do take that without making your own judgment whether to take this for this much amount of time. Don't do think all these things and stop the drug earlier. If some drug is prescribed for a long time, you take it for a long time without questioning. That is a simple thing. So I hope this video was useful for you. I will see you in one another useful video like this. Until then, it's Dr. Aravind signing off. Om Shakti.